I feel dysfunctional breathing is way underlooked across many of the patients we see, many of the population. So I've kind of reframed how I look at folks coming in to see me that are suffering from a pain complaint, that most of them don't have a good breath practice and aren't able to fully breathe. They often have restrictions in their thoracic spine and rib cage, restriction in their diaphragm, and just never been taught how to actually breathe and how to dial down their nervous system through breath work.
Tim Flynn's back on the show. 2 years running.
Oh, really?
2 years in a row at
Outstanding.
live at the conference. Synonymous with manual therapy education and clinical excellence from the Army Baylor PT Program, Evidence in Motion, to your own Substack, which we talked about last time. We'll get into that a little bit. And your book. How is it a year later?
Oh, man, you're putting me on the spot. It is not any further, well, it's a bit further along, but it's not published, so because I kind of started doing some other stuff.
You're like me. Are you doing 20 things at once?
Well, no, that's a good question. No, it's just focus. There's no excuse, and my son's been on me, Dad. What he hears me talk. Why isn't this in a book? So, okay,
it'll get there. Well, now it's recorded, so now it's on the record. So you got to do it.
Oh man. Okay.
We talked a little bit about this last year, so I'll ask a similar question, but not the same one. You said transforming our sickness industry starts with one encounter at a time. What does that actually look like when you walk into a treatment room?
I think what I feel that way, it's bigger than even the treatment room, because I think a lot of the folks in this area, they get calls from friends and family.
Oh, always.
I mean, and so I guess I would broaden that. What does it look like? It always starts with that first question, what's going on in your life, and tell me what's going on in your life and what's good, what's bad. And from there, I would say, shut up.
Yeah, and listen. Is that what you mean? Like make sure you're taking that information.
Just listen, and I think I've gotten better. It's still a challenge at times because I like to talk, but no, I'm much better at listening. And and it's really that. We know motivational interviewing, we know those terms, but to do it well is, I think, in my opinion, you have to do personal health well, meaning you have to have a mindset of breath work, meditation, quiet time in your own mind to be quiet with others. So I really try to be disciplined in that practice in my own life.
Yeah, good advice.
So,
let's talk about your session on dysfunctional breathing bridges, manual therapy with anxiety and pain. How do you connect those dots for patients without sounding like a TED Talk?
Great question. Well, first and foremost, I feel dysfunctional breathing is way underlooked across many of the patients we see, many of the population. So I've kind of reframed how I look at folks coming in to see me that are suffering from a pain complaint, that most of them don't have a good breath practice and aren't able to fully breathe. They often have restrictions in their thoracic spine and rib cage, restriction in their diaphragm, and just never been taught how to actually breathe and how to dial down their nervous system through breath work, which goes back thousands of years, and you start to do the research and think, well, and look at where these practices started, and we're not that smart. We just forgot about all this good stuff, and now it's coming back into vogue, I guess you would say.
Is it because it's not a shiny object? Is that why we've sort of maybe overlooked it?
Yeah, it's not a shining object, and I think because when learned, it's free. It's you don't have to pay for it.
Sure.
It's stuff you can do by yourself. You can do guided for free. You can do, so I think a lot of it's that there's no one's behind pushing it to say, this can help. And the other thing is, I think there's just not a belief. And again, if you don't believe something's going to help you, the benefit is much less. We know that through the data. So I often say in like a wellness workshop, it's like, if you're not personally doing breath work and some type of mindfulness-based practice, you're just not a good salesman. And, so I think that's where, when you ask the question back in the clinic, I would say it's tell your own story, and why, I've been doing this. I was wired pretty tight, and I've really found this to be helpful, and that works. But often it depends on the type of clinic. If you see, a lot of folks I think people here see are individuals that have not been successful at other places. So I think sometimes it is an easier sell because, are you going to continue doing the same thing, or are you open to maybe let's try maybe a different approach that instead of just banging on this area that's been painful, let's take more of a broader perspective that gets you into the breath work and get you into, nutrition and sleep and the other levers.
Reading the room, knowing the audience.
Exactly.
Seeing what they're open to.
And I think, I used to say, and maybe I said this last year too, is that, data won't change it. It's personal connection and what matters in their life will maybe change that behavior.
Yeah.
But to the second part was the anxiety piece, and I think, the data on anxiety, as you know, is just through the roof. And the science, when you look at comparative effects of medication versus breath work on anxiety outcome measures, it's like, whoa. It outperforms many of the drugs, or at least it's comparable, and yet that's not the first-line solution when somebody comes in with an anxiety disorder, whether it's their primary care, to their psychiatrist, or to some mental health professional. It's medication first versus no. Not to say there might not be a role for some people, but let's start with the stuff that doesn't have side effects first. Seems like a reasonable, practical way.
Going the other way seems a little harder.
Yeah. So I think that's fascinating to me anyway.
Yeah. After teaching thousands of PTs, what's one lesson you hope still echoes in their treatment rooms? After being an instructor to so many, what's the thing that you hoped that stuck around?
That's a good question. I would probably just hope that in the end, kindness, caring, and just sitting across from a fellow human, if I can do that and be present, I'm more than halfway there. Yeah. So, and that's not easy to do.
Simple, not easy.
It's simple, but it's not easy because there's so many pressures and that are happening. But if you can take that cleansing breath prior to entering that space and just, I think it's sacred space, and I really, those terms sometimes are overused, but I think a clinic room and what we do, it's sacred space of two people coming together. That's a lot of trust to say, you're coming to see me that I can help you out in life, and I don't think we give that enough credit. So I think that's what I hope they remember.
That's great. If you were designing a PT education from scratch today, what would you remove and what would you double down on?
Great question. I would remove any material that's, again, there's a lot of material that academicians often say, we need to teach this because it may be on the boards or it may be here. It's basically teaching stuff to a test, and so there's a lot of that still goes on. So I'd remove... I'd remove any, lectures you come to a classroom and sit down. I just don't feel you can have, quote, micro lectures throughout a lab session, which I think are very helpful because they're delivered at the time point that you're putting it to use. So that type of sprinkling and reinforcement types of discussions I think are extremely important, but to actually come to a classroom and sit down
for 3 hours.
Yeah, that's brutal. That's just that I would totally remove. Now, what I would add, I'm going to forget the name of the schools down in Austin. There's a new K through 8 and now it's K through 12 program. A tech guy built the schools and now they're pushing them out, and they're built on this wonderful concept of saying, hey, it's not lack of effort. When students start to fail, they have a hole somewhere in their knowledge. And a great example he uses, it might be an 8th grader, algebra or something like that, and they're struggling, and they should be able to get everything correct, or greater than 90% correct if you're going, especially in mathematics and things of that nature. But they may be missing something that's a second grade level concept that they just didn't quite get. You don't need to send them,
but they move past it.
They move past it, but
there's
just
that hole.
But then that hole just keeps compounding.
Sure.
And so I guess where I'm going with that, the way they've done it there is just they're just totally leveraging AI and gamification for that type of material. And when you find the hole, boom, it sends you to back here. Oh, you need to pick this up, and then you can come back. But what's so motivating about it is, a big part of their school day, they still have as many teachers, but they're really guides and coaches from that for working on this. I don't want to use the term, what's a good term? It's not soft skills, it's skills, human skills of connection and functioning and building stuff at age appropriate stuff and creating things. That's what the coaches are there. But in about 2 hours a day, they're getting their kind of didactic work, and the quicker they're done, they move out, whether it be into sports, music, whatever their gig is, but they're motivated to get this done, then I go do my fun stuff. But then as group stuff, they're doing projects that matter, that build on the scaffolding that they did there. Now, if I take that out to, what we're doing in DPT education, so many, you can ask any educator, they struggle with anatomy. They're coming in with not even a foundational anatomy, physiology. They've taken a course, but and they've got an A or B in the course, but they may have, 30% of the knowledge or 20% they really didn't get. That's foundational to, you're now trying to teach some more complex kinesiology type stuff, and you're realizing they don't even have the basics of that. So I guess I'm interested in moving downstream, which is the bigger solution. But if we can't do that, at least having modules, everybody kind of starts at a baseline, and before you even enter, you take these for 2 weeks, because we can give you data that says, hey, if you struggle in these courses, you're probably
it's going to make it harder and
harder. And it compounds throughout. So instead of saying it's a lack of effort, it's not a lack of effort. It's just they have some holes, but serving up the remediation, not a frickin' course, just it's this slice. And that's where I think the technology, I'm pretty excited about the ability, of those types of things like anatomy, physiology, kinesiology, biomechanics, foundational things that could be delivered way more efficiently, but also at a much higher level, because we know the students are getting that. So we spend our time in the labs in, teaching, handling skills, teaching, motivational interviewing skills, providing them video feedback, like, look at your eye contact. Is that how you want your provider to look at? And actually giving the facial recognition, say, hey, you can get that feedback. So I'm not I'm a hands-on manual therapist who believes we can double down on that, because we can leverage other things that we could, create content and whatnot that allows us to focus on the hard skills of, handling patients in comfortable ways from all walks of life that may be tactile defensive, may have this or that, and as well as the ability to communicate, which I would totally increase communication skills.
Simple, not easy. Why are these soft skills so damn hard? I told you I want to do a presentation at CSM on that one year. I think it's valuable, right?
It's extremely valuable. It is the sauce. So yeah.
Well said. Want to make sure you get to talk about your new vest, man. What's the deal with the orange vest?
So I'm the Foundation for Orthopedic Manual Physical Therapy, FOMPT, or FOMPT. We started. It's now, really this conference hitting its stride in terms of, a true campaign to raise money. But essentially, what the foundation does, it provides first and foremost research grants. We just gave a $150,000 research grant. It also is involved in advocacy for OMPT to really advocate for our profession. And it also, a big part is just, we have the accreditation body, or ACOMPT, sits the foundation. It sits under the foundation, which is responsible for accrediting fellowship programs throughout the country. So those are the big arms that we're involved in. And we're a lean, mean organization that has, tried to immediately get money so that we give back to the profession. And, we've been fortunate to have some large donors. The Paris Patla Foundation donated for a large amount of money that allowed us to give some large research grants that we'll be giving annually. And We've given a number of scholarships to fellows in training, and ultimately it's just about, elevating the profession and providing, the future. So
Fantastic. Well, good luck with that. More information, is there somewhere you want to go?
Yeah, the FOMPT.org, FOMPT, and or you can go to the Academy website and go there. And of course, those that are at this conference, you'll see us in orange vests, and
That'll be your thing.
Yeah, I got drink tickets for tomorrow night. We got an AC/DC cover band, and come see me. I can get you a free drink. Just give me $25 or more.
Twist my arm.
That's all you got to do. So
last thing we do on an episode is parting shot.
Okay.
Did it last year. Can be different. What do you want to leave with the audience? Soapbox statement, mic drop moment. What's the last thing you want to leave?
Boy, Jimmy, those are. I should have been prepared for that. You came
Well,
in strong.
no, I like when we don't prepare for this because it doesn't need to be the only thing you're known for. But if what's one thing you want people to hang on to from something that?
Just give a shit. I think we're at a time
might be one
where
of the best ever.
We just don't. I don't think sometimes because there's so much noise, so much stuff going on that we get overwhelmed, and it's easy to just kind of F it, man, And I think we just got to guard against that, and that's what this conference gives us energy to say, because everybody in here gives a shit, and they really care deeply about the patients they serve, and that's why we're here.
Yeah.
So
sometimes that's the difference maker. I was taught a long time ago, from a smart former boss, and I said, how do you pick between these two candidates? Like, they're both kind of equally matched in experience. And he's like, well, we're going to go with that one. Like, well, what's the difference? He's like, you can tell he gives a shit. I'm like, well, why is that why does that matter? And he's like, because 6 months from now, when it gets real hard, he's going to show up and he's going to keep trying. This other guy, I don't know if I say it enough. I was like, oh, I got it. And he said the greatest line: you can't really teach give a shit. You got it or you don't got it. But you got to remember, when you have it, you got to use it.
Isn't that great, man?
So
you pulled it out of me.
You went from saying, I don't know if I had anything, I'm going to give a shit. You got one of the best ones. Tim Flynn, appreciate the time here.
Hey, appreciate it. Thanks so much, Jimmy.
Thanks for listening to Hands On, Hands Off, the official podcast of AOMPT. Subscribe now so you never miss an episode, and connect with us at aompt.org or at AOMPT on social. Opinions are those of the guests and not official AOMPT policy. See you next time.